Hello. Welcome back to Dr. Hayatu Medical Session. Today we'll be discussing an important topic, Irritable Bowel Syndrome, IBS. Before we begin, don't forget to hit that subscribe button and ring the notification bell to stay updated on our health content. Inflammatory bowel syndrome is a chronic inflammatory condition primarily affecting the gastrointestinal tract, characterized by recurring episodes of inflammation. It encompasses several disorders, including Crohn's disease and ulcerative colitis. These conditions involve an abnormal immune response to environmental triggers in genetically susceptible individuals. The exact causes of irritable bowel syndrome, IBS, are not fully understood, and it is likely to involve a combination of factors. Some potential contributors to IBS include changes in the gut motility or movement, dysfunction in the communication between the brain and the gut, low-grade inflammation in the intestines, imbalances in the gut microbiota or bacterial overgrowth in the small intestine, stress, anxiety, psychological factors. There might be also a genetic predisposition, as IBS can run in families. Irritable bowel syndrome, IBS, can manifest with various symptoms, and individuals may experience a combination of these. Common symptoms of IBS include abdominal pain, typically relieved after a bowel movement or after restroom, changes in bowel habits like diarrhea, constipation, bloating, feeling of fullness, abdominal distension, and increased gas. Stools may vary in consistency, ranging from loose and watery to hard. Urgency to have a bowel movement, which is a sudden and urgent need to use the restroom. Incomplete or feeling of not fully evacuating the bowels. Some individuals may experience fatigue, possibly related to disrupted sleep patterns or the impact of symptoms on daily life. It's important to note that IBS is a complex condition. The symptoms can vary in intensity and may come and go over time. Diagnosing irritable bowel syndrome typically involves a combination of clinical evaluation, medical history, and specific tests to rule out other potential conditions. Common investigation modalities include blood tests can help rule out conditions like anemia, celiac disease, or infections. Stool samples may be analyzed to check for infections, parasites, or other abnormalities. Colonoscopy or flexible sigmoidoscopy. These procedures involve examining the colon or a portion of it to identify any structural abnormalities or signs of other conditions like inflammatory bowel disease. Imaging studies. X-rays or other imaging tests may be used to visualize the digestive tract and identify any abnormalities.
Some individuals may undergo a trial of eliminating certain foods to identify potential triggers. As psychological factors can contribute to IBS, psychological assessments may be considered. It's important to note that there is no specific diagnostic test for IBS, and the diagnosis is often based on the presence of characteristic symptoms and the exclusion of other potential conditions. Managing irritable bowel syndrome often involves a combination of lifestyle modifications, dietary changes, and in some cases, medications. Here are some general strategies for managing irritable bowel syndrome include dietary changes. Identify and avoid trigger foods that worsen symptoms. Common triggers include certain types of carbohydrates, fatty foods, caffeine, and alcohol. Consider a low FODMAP, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, diet under the guidance of a healthcare professional. Gradually increase dietary fiber as it can help regulate bowel movements. Soluble fiber found in oats, beans, and fruits may be particularly beneficial. Probiotics, which are beneficial bacteria, may help regulate gut flora and alleviate symptoms in some individuals. Practice stress-reducing techniques such as deep breathing, meditation, or yoga, as stress can exacerbate IBS symptoms. Engage in regular physical activity as it can help improve overall digestion and reduce stress. Depending on symptoms, medications such as antispasmodics, laxatives, or medications targeting specific aspects of IBS may be prescribed. Cognitive behavioral therapy or other forms of psychotherapy may be beneficial in managing stress and improving coping mechanisms. Ensure adequate fluid intake to prevent dehydration and support digestive health. Establishing regular meal times and avoid skipping meals to help regulate bowel function. It's crucial to work closely with a healthcare professional to develop an individualized management plan tailored to your specific symptoms and needs. Additionally, keep a food and symptom diary to help identify patterns and share this information with your healthcare provider for more effective management. If you found this information helpful, subscribe for more health-related content. Thanks for tuning in, and until next time, stay healthy.